Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. Live in studio. It's cool outside. Not real cold, but cool. The humidity's gone, I think. So anyway, 888-630-9625. 888-630-WMAL. Love to talk to you on any subject that you have in mind. Perhaps you have a question, you've tried, you've applied, a problem that just doesn't seem to go away. Well, this is an opportunity for you to fix it. You know, we can show you how to do it without drugs, without surgery. As always, we have a topic that we're going to springboard with today, and I have a very special guest in studio to help me do that. But this is a problem that can affect up to 20% of the population. It's one that we really, don't ask the question, why is that, frequently enough, but we try to placate it. We try to suppress the symptoms. The problem is it gets potentially worse and things get more difficult as time goes on with degenerative disease, and sometimes cancer can come about. And we're going to talk about, and what are we talking about? We're talking about all those things that affect the intestinal tract, such as irritable bowel disease, irritable bowel syndrome, Crohn's disease, ulcerative colitis, things of that nature. And to talk to you about it is Dr. Scott Lamp.
Yes, good afternoon, Tom.
It is good afternoon. It is good afternoon. We often make that mistake and we say good morning, but it's not morning. It's just that transitional time.
You bet.
That's the hocus pocus time. Anyway, this is a topic that we see a lot of, and it can cause all kinds of secondary symptomological presentations, such as joint pain, headaches, the arthritic type of formations, and it can predispose.
Skin problems.
And skin lesions as well, absolutely. So, Dr. Scott, let's talk a little bit about, this paradigm of bowel intestinal tract conditions, because it's important that people understand, one, they don't have to be drugged in oblivion to deal with this stuff, but more importantly, it can be resolved 100% if the right answer to the question, why is that, is answered, because there's a plethora of different types of things. But first, before we get into the causes, and what I want you to do is kind of really describe for us what irritable bowel disease, irritable bowel syndrome, colitis, how they affect, what they are, and that's a big, question to start with.
Well, first off, let's deal with irritable bowel syndrome. That's the one that almost, you're talking about the 1 out of 5, probably the number one, kind of secondary to maybe a cold going into a doctor's office, being complained about. It's kind of like they talk about a spastic colon switching from diarrhea to probably had constipation, with little to no inflammation associated with, at least by definition. When you get into a little more serious things, you get into called irritable bowel disease. That's the Crohn's and ulcerative colitis. They have an overlap of symptoms that are very similar, but that has to get into the inflammation of the lining of the intestines. And one particular one, ulcerative colitis, gets on the very superficial aspect of that area, and then the Crohn's disease actually goes through the whole wall, can go through the whole wall of the intestinal tract. And this is, very, very some serious stuff. And when you're talking about maintaining the best health you can possibly have, the intestines play a major, major part. You take a look at, I think the feelings out there, depending on who you read, 60 to 90% of our immune system is located here.
Well, we can begin to break down these different type of syndromes. Interestingly, when I was an intern, one of my first patients was a young guy with ulcerative colitis, and the poor guy, 30 to 35 bowel movements a day, bloody stools.
Ouch.
cramping. He was emaciated. He had gone from about 185 pounds at 6 foot tall down to, when I met him, he was about 135 pounds. And it was just eating him up, and there was virtually nothing at that point that could handle the situation. Fortunately, in conjunction with the clinic director who taught me quite a bit at that time, we're going back a lot of years, I used acupuncture and some dietary changes and some other aspects of natural therapeutics, and we were able to turn him around. It took a while, but he had almost full resolution. He went into then an irritable bowel syndrome where occasionally he would get some cramping. But the differentiation, I mean, that's an extreme condition, but this situation can present itself in many forms. It can present itself, meaning we're talking about a problem with the gut.
Exactly.
We can see cramping, we can see colitis, we can see mucus, we can see constipation, we can see diarrhea, and so forth.
Yes, and I think it's just like you go up to how many different effects can like a yeast infection have on the body too. When you start changing that internal environment, there's so many different things that get affected. You're absorbing this into our system. And so when you do that, you're going to have what I talk about atypical symptoms. They're all over the map. You can have somebody coming in, one was having migraine headaches could be caused by some of these things. You could have somebody in regards to having problems with some acne problems and those kind of aspects, inflammation of the skin. Is there things that are just coming through that the body's not processing through and can't absorb correctly, and it all starts in the gut? 888-630-9625. That's 888-630-WMAL. That's how you talk to Dr. Scott Lamp today. And if you'd like to attend this Wednesday evening, the 6th of February, oh my gosh, 6th of February already. The year is, gone. Flying, yes. But anyway, you're going to do our in-house continuing education program this Wednesday evening, 7:30 p.m. at the Roselle Center for Healing. If you'd like to attend, if you have a problem with your intestinal system and nothing's resolved it, you're taking all kinds of medications to kind of keep it quiet, your life has been restricted dramatically, and you want to know how to get it back, this is an opportunity for you. Give our office a call, 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend Dr. Scott Lamp's presentation this Wednesday evening on intestinal tract dysfunction, irritable bowel conditions, and so forth, and say, hey, listen, I just want to be there. I promise you, you're going to be able to look at this and say, there's a way to get out of the hole. Dr. Scott, let's talk a little bit about the process of presentation. Somebody comes into you and, they have, and you're asking questions and you go through the history. I've got intestinal tract cramping, and, you're going to go through. And how do you know that it's just not plain old constipation, that they haven't had a bowel movement in a few days, or they had a bug, and the bug is going away, or one of those things? How do you begin to work your way through the matrix on this? Well, I think you got to take a really good history on some things and kind of check that out. And I think one of the things to look at, one is you got to make sure it's not one of the two bad guys, which is the ulcerative colitis or the Crohn's disease. One of the things with that is a mucus discharge is a big item for those two. Bloody diarrhea is another one with those. You're going to see a lot of things with malabsorption type problems. Nutritional deficiencies are associated with that. And also, I think things like Crohn's and ulcerative, you're also going to see some joint pain. Also, with that, maybe some skin aspects that are going to be associated with that. And you can see additional things besides just abdominal problems with that there. And then you got to start going into, when you're looking at those, you probably have to work on some testing on some things too. We got to work on some testing for allergies and sensitivities. Lactose plays a big one. Gluten's a huge one. And then see what kind of reactions they've had for foods with those regards. Well, obviously we're seeing more and more patients come in with intestinal tract problems. A lot simply because the diet of the average American is terrible. Right. We're eating junks. The sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives. My mantra. This is the mainstay of the American population. When I say you have to eliminate these things, people look at me and say, oh my God, what am I going to eat? The problem is they're coming in and, they're constipated. People think that they're having a bowel movement 3 times a week is normal, where they should be having a bowel movement every time they have something in their mouth. Look at the medical model and they talk about what's supposed to be good transit time. If you look at a holistic model, it's usually 1 to 3, and I like to see more than 1. 1 to 3 per day, where sometimes it's 3 to 5 a week is okay sometimes on the medical side, and that's not quite how the body functions. And it's kind of interesting. Take a look at the African population, the nomadic tribes of Africa. and where they hardly have any problems with colon cancers. They have hardly problems with Crohn's disease, ulcerative colitis. They're taking in, of course, they're also taking in 60 grams of fiber on a kind of daily basis. They're also walking and moving and exercising. It's kind of interesting to take a look at those cultures where Crohn's and ulcerative colitis seems to be of an area of affluence where people are industrialized and we become sedentary. So all those play a part with this.
This is a condition really that you look at. We talk about the triad of health all the time. Mm-hmm. Structural, chemical, emotional. Structural meaning neurological based conditions through injury, biochemistry, all those things that you are affected by that are outside the body that come into the body, electromagnetic waves even, and the emotional piece. This is a condition that often has all three components.
Definitely.
And if it's not because it was started emotionally, ultimately simply because of what you said earlier, that the intestinal tract is the immune center for the entire body, but also produces many of the neurohormones that are necessary to maintain emotional stability.
Yeah.
Serotonin, one of them.
Neurotransmitters right there on the button.
So when you treat this condition, we have to treat all three sides.
Right.
And look at all three sides.
Right. And I think you bring up an excellent point with the element of the triad, that the emotional aspect, that we go back always to that primitive reflex of stress, is that when we want to run away, the body's not going to worry about digestion. The lion's chasing after you. You're not going to stop and there's a taco stand. You're going to keep running. And what happens is the digestive system starts closing down. So now you've got bad foods coming in. You've got an emotional stress that basically, if it's stressing to a certain point, it doesn't want to shunt the blood to the digestive tract to get the fluids it needs to run its course.
Now, the fight-flight phenomena is one of the things that we don't realize how significant of an impact it is in our entire immune system, but particularly in this situation.
Very much
because
so.
As you're talking about in the intestinal system shutting down, we call that's parasympathetic responsibility. Those are the things that we don't think about. They digest foods, they do what they need to do, but those things aren't working. And then sympathetic that's where you fight the tiger.
Right,
and
right.
Unfortunately, we're fighting the tiger all the time, either because we're in a stressful situation, our financial situation is not in a great place, we're emotionally in a bad place, we're eating the wrong things, we're putting up with pain on a chronic basis, and everything stops.
And and the thing is, what day is today, Tom?
Today, Super Bowl day.
Okay, and if your team loses?
I'm not going to be happy tomorrow.
And what are you eating?
Yes, not me, wrong person. I will eat well tonight. But yeah, you're right, absolutely. People are going to eat junk and all kinds of. They're going to drink too much today. They're going to eat too much garbage. They're going to sit there filling their faces with pizza and nothing else.
Sensitivities, sugar, sweets, all those kind of things.
And tomorrow we will have an office full of people who are going to be complaining that they don't feel good, they have headaches, their intestinal tract isn't working the way it's supposed to, their joints are hurting, and they have fever.
Bingo.
All the things we're talking about. 888-630-9625. That's 888-630-WMAL. Love to talk to you. We're talking about irritable bowel disease and Crohn's and the things that make you very unhappy, emotionally as well as physically. Some of those skin irritations that you have are coming from the topic we're talking about. This Wednesday evening, the 6th of February, Dr. Scott Lamp will be your presenter at the Roselle Center for Healing. This is the subject. This is what he's going to talk about. And if you'd like to join us, we encourage you to do so. You can actually find out how to fix this thing. Call us 703-698-7117, 703-698-7117. Real quickly, we got a minute before we have to take a break. Talk to me a little bit about the increased incidence of all the things we're talking about simply because of the increased glutenization, if you will, of food.
Well, I think the more, and the problem is how can you get away from it? I think the more that happens is the more we charge to change the gluten. I think one of the, we're talking about a lot of GMO gluten. I think, and I've done this with you, Tom, in regards to getting breads from Sicily and testing you on it. And and if I can say that, you're sensitive. So when I test you on that from the breads from Sicily, not a problem. I test you from here.
I think that's mental on my case, though.
Well, what could be?
I'm relating to my culture.
I don't want to get into the mental part of it.
No, we won't.
But on the other hand, when I do that, I've also tested other patients that way. So there's something with the change in the food that we're doing here, and it's not a natural base. And I think that's one of the things is it's actually irritating gut linings. And they say about 83% of the population right now have a problem, and it's increasing. We're going to talk more about gluten and other things that irritate your intestinal tract when we come right back after these important messages. Don't go away. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program.
My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com. Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series Video on Demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live. We are in studio. 888-630-9625. 888-630-WMAL. That's how you find us, and how you find us this Wednesday evening, the 6th of February. My guest, Dr. Scott Lamp, will be your host in office for our continuing education program. He's going to be talking to you about irritable bowel problems and ulcerative colitis and all those things that make your intestinal tract not work. You know what we don't realize with intestinal tract function problems, you can end up with things like chronic fatigue that never go away, pelvic pain, the whole perimeter of that pelvic area, jaw problems, which is something that most people wouldn't think about, depression, anxiety. The list really goes on. And so when you have structural problems and back pain and disc-like syndromes and arthritic conditions, it can be all in the intestinal tract, and one perpetuates the other. Dr. Scott, let's talk a little bit about how all this nonsense starts. But, I want to take it from a very specific condition because we've got more of the program and we'll get into a little bit more of the other things later on. But we do some very intensive investigation when we begin to suspect that some of the problems that we're seeing in office come from the intestinal system. The gut has been noted as being the second brain in many cases. Mm-hmm. And
it's a booklet that steps that.
Absolutely.
Yeah.
And so when you're dealing with the intestinal tract, we see good bacteria, bad bacteria.
Right.
Okay, it has to be a symbiotic relationship. That's how we stay well. But over time, because of our exposures, because of lack of digestive function, and the things that we don't do for ourselves, we end up with all kinds of harbingers living in that gut.
Right.
How common is that?
Very common. I think when you're taking a number on it, I think probably like 3/4 of the people, I would say 90% of the people, at least we see in their office, that have some type of gut issue. I think even when you did your special, one of the things we saw was a constant thing of some type of allergen, either to a gluten allergy or some type of thing, brought on by, okay, well, how many times have we have doses of antibiotics out there? And then we change the gut flora. And you might not be taking antibiotics, but you get antibiotics, and is it in the water supply? Is it in the foods that we eat? Where is it coming in? And all these things that we're bringing in, and the constant insult on our bodies, and things start breaking down and start calling. And we haven't really talked about leaky gut, but that falls right into these allergy things. The whole thing. The
immune system starts in the gut, and when we have all these things that start attacking the intestinal lining, we end up with cramping and irritability and inflammation and all those other things that can ultimately become a primary condition because, God forbid, medicine would ever ask the question why they got there in the first place. But we're sitting here, looking at this integrity, this intestinal tube, and we know that it has primary control over immune function and so forth. But when we look at 60% of the population has parasites.
Right.
Identifiable parasites. That's not to include the bad bacteria like things that we see all the time, pathological bacteria like Citrobacter and Klebsiella that live in the gut.
Right.
These things are awful. If you have a dog or a pet and you like to kiss your dog, look out for H. pylori. Right. And it goes on.
Right. And that's an interesting thing. I think a lot of times it starts off. We're talking about. A lot of this, if you haven't taken the picture of this, is pretty much on the small intestine, large intestine. I was here earlier, or within last year, we talked about GERD being more the upper part of digestion. It all goes together. And you talked about H. pylori, and that's an interesting thing, is where does digestion really begin? It begins, and you think about it, let me ask you this, Tom. Where do you think digestion begins?
Where do I think digestion begins? I think digestion begins by smelling.
Right. It starts in the brain.
That's right.
Okay, so you smell it, you sense it, you hear it, you see it. That's Fifth Avenue, as you would say, Fifth Avenue advertising. When you go, I'm amazed when I go to the movie theater and sit back and see all the popcorn and Coke and everything else flashed in front of your face. Eat this, eat this, eat this, eat this. So that starts the whole process. The body, it just feels for food and it gets that going. What's the first thing? We're in a hurry and we don't chew the food. After that, we get the food in. We start to get this preparation. And my analogy, and I've talked to you about this before, is it's like an uninvited guest coming to the house. You know, somebody shows up at your doorstep. Am I supposed to put them up for the day? Am I supposed to feed them? So on and so forth. The body needs to prepare foods to break it down, and we're all in a hurry. We smell it, but then we chew it. We don't even chew it. We gulp it down.
We gulp it down.
And what happens is when you chew, you actually send a signal to the stomach saying, this is coming down.
Well, we think we're animals. We think we're animals, right? Because they just kind of gulp their food down. But the problem is that they have many more times as much hydrochloric acid in their stomach we do, and we try to put ours out by taking all these protein pump inhibitors. But if you don't chew, if you don't digest your food in the mouth first, to trigger the stomach to produce pepsin and hydrochloric acid, then to trigger the small intestine to produce the pancreatic enzymes and the
gallbladder.
And the gallbladder.
And the gallbladder to get this stuff to dump. That stuff, all that's now becomes slowed. All becomes slowed because of the fact that we're in a heart, and then here comes the mental part. And then sometimes we're looking at things, what's the gray area between what we're eating that's bad, and also on top of what's the stress mechanism. And I think we're getting away. I talk to patients like, what do you do when you sit down to eat? Do you do a prayer? I'm not trying to get into religion here, but do you take a moment to pause to get your body to be prepared?
Not too many of us. My guest in studio, your host this Wednesday evening, the 6th of February, Dr. Scott Lamp. He's going to be talking about intestinal tract function problems, irritable bowel disease, and so forth. Give our office a call at 703-698-7117. Tell my staff you'd like to attend. We'll be right back after the news and some important information. 888-630-9625. That's 888-630-WMAL. Love to talk to you. We're talking about irritable bowel problems, disease, and syndrome, and also the colitis, and also, all those things that make you miserable. And my guest in studio, your host this Wednesday evening, the 6th of February, Dr. Scott Lamp. He will be your presenter. He's going to be talking about this subject, but more importantly, how you can rid yourself of this really nasty bug that, if you want to call it that way, this syndrome, this condition, this, 20% of us.
Yeah,
or more,
and
it's growing.
And the thing is, it's getting worse. You take a look at, for example, like Crohn's disease. Sometimes there's people, they say as much as somewhere like 75% of them somewhere in the line will have some type of surgical aspect associated with it. And that's, I think there's ways to calm that down. You don't have to have those numbers that high. There is definitely ways to take a look at it, but you have to really look at yourself in regards to what you're consuming, what you're exposed to, and change a lifestyle. I mean, it can be worked with.
It's really a treatise on our society when 1 out of 5 to 1 out of 4 people suffer with a symptomatically productive type of condition like this, and they're in most cases are unwilling to make lifestyle changes to fix this, and it's fixable.
It's amazing how food can be an addiction to some extent, and how to. I mean, that's where, even with the stress aspect, the second aspect on this is the emotional feeling. How am I emotionally connected to that food? That is the hard part when you're doing some treatment with this.
The interesting thing is that in acupuncture, in traditional Chinese medicine, every organ system has an emotion that's tied to it. The lower portion of the bowel, the large intestine, is related to the lung, and they both have an interesting emotion called grief. And so when something's happened in our life, because we're never taught how to resolve things, often it can log in to that area. It can log into the gut. It can log into that other organ system, the lung. And here's a situation where people end up with bowel problems, lower intestinal tract problems, simply because the lung is being irritated. So this goes back to a place where environmental stimulations, toxins, all the junk that we're breathing in on a day-to-day basis. But let's explore a couple different things. We know that injury will cause it by either injury to the skull or injury to the lower back will cause an irritable bowel type of condition. But more than not, it predisposes the terrain, the environment, if you will, to all these other things that come into it.
Right.
So when you have an injury that affects the nerves, then the organ itself can't work properly.
Right.
Okay? So now you got all these other bugs. We talked about parasites. We talked about the inability to handle foods. Right. All these things, and then we're stuck, and people get put on medications that you wouldn't give to your enemy. And
it's a negative feedback loop, too, because, all right, I have something that comes that irritates my system. It irritates the terrain, as you were talking about, the intestinal lining. And now the intestinal lining leaks. It leaks, something gets into the system. Now we create another allergen or a sensitivity or problem. That goes into place, and then it just keeps on feeding itself. Then you have one allergen, then you have another one, and it builds and builds and builds. And again, you got to, what do they say, stop the madness, is you got to go back and say, how can I eat a better diet? You really have to do some dietary changes. There's a strong chemical aspect on our triad of health here that also needs to be addressed to make sure you change those things, and or you're going to keep on feeding it. And I don't know what you've seen, Tom, in regards to sometimes with wheat, going back to that sensitivity aspect. Oh, I've been off it for 2 weeks, I feel better, and I just had it, I snuck in a couple pieces here and there. It will come back, and it can stay in your system for, they're sometimes saying a month.
Well, it comes back
or more.
It comes back with a vengeance, too, right. Because, if you've been off and you allow the system to start healing up, the nervous system gets dampened, if you will, if you beat it up all the time. And then pretty soon now your nerves are starting to come alive, tissue's starting to heal, and you put this culprit back in, and all of a sudden it rips you up like nobody's business. You were asking a question, we were talking at the break, because of Super Bowl today, how many people are going to end up having to take for the rest of the week antacids, and they're going to take the Prilosec, and they're going to do all those things to try to put the fire out, because their gut is going to be a mess for at least a week to 2 to 3, maybe a month, because of all the garbage that they just put into it, wrecking their immune system and making things much worse and predisposed to other conditions.
And another thing I was just thinking about, when you asked about, when you look at chips, for example, or something that's overly cooked. Some of those things cause inflammation by themselves because there's no enzymes, there's nothing in that food that actually help you digest that. So now you put additional burden on the body to be able to take care of that. So bacteria, viruses, the cooking of the foods, are they overcooked? And some of those elements all play a part into, this misery that we seem to have.
When we talk about the medical approach to handling these things, and we're dealing with the different types of medications that are basically tranquilizers of the gut, that's all they do. But the problem in tranquilizing the gut or knocking down the enzymes of the gut that the gut needs to digest food properly, you end up potentiating the problem. Before we go on, Dr. Lamp is your host, your presenter this Wednesday evening. You can get into that class. And by the way, these classes are always our gift to the community. You're welcome. There's no cost, but we do require a reservation. Just call our office at 703-698-7117. Let's go to the phone. Shirley, how can we help you?
Thank you for taking my call.
You're welcome.
You and Dr. Lamb. Yes, I have 2 questions, if I may. The first one is about melatonin, and what is your theory on that? And can you take it if you have autoimmune disease? It is arthritis and autoimmune disease, and what medications will interfere with that? Blood pressure, Maxide, and all that.
That's a lot of questions.
I know. You both are experts. I know you can help me.
Which one do you want to handle first, Doctor?
I don't care.
Okay. So melatonin is one of those supplements that a lot of people want to use for sleep aid. And it's a natural hormone that the body produces, the brain should produce. Unfortunately, because of many different things, because of injury patterns and other imbalances in the pituitary and adrenal reflexes, we don't go into a normal sleep cycle, so we don't produce melatonin at the levels that we should. However, you can get a place where you're taking way too much melatonin, and body has a normal rhythm, it has a normal level of production, and it's produced mostly at nighttime. It's a neurohormone, meaning one that helps regulate other pathways in the brain. But if you're going to take it at nighttime and you're constantly having trouble sleeping and your hormones aren't working the way it's supposed to, less is always better with this hormone, and maybe 1 to maximum of 3 milligrams a day, but I wouldn't take any more than 1 to 2 without supervision, because you're going to be offsetting other regulatory cycles within the body. And that's where the problem comes in with all of these things. So getting into autoimmune reactions, it's only part of the pathway. When you talk about melatonin, you also have to, at that point, get into talking about tryptophan and serotonin production and the regulatory pathway with that as well. So it's really a topic, Shirley, that we could talk about for the rest of the program.
Hello?
Shirley, are you there?
Yes, I am.
Okay, we could talk about that subject for the rest of the program. It's a very extensive subject, but what I would suggest to you, if you're having problems sleeping, make sure you're sleeping in a black room, totally dark, that there's no digital imprints, that your room is slightly cool at nighttime. It's not real warm because you're not going to sleep if it is, and that you're eating a little bit of protein about an hour and a half or so before you go to bed, which will keep your blood sugars from crashing and keep you asleep so you don't wake up.
What do you think? You said 1 to 3 milligrams?
1 to 3 milligrams at nighttime before bedtime, and I wouldn't take much more than that.
And with arthritis, it doesn't matter if you take the melatonin?
No, you're not going to cause any problems at that level. Arthritis is a whole different ballgame. You need to make sure with an arthritic condition what's causing it. That's more important than anything else. Arthritic-like conditions, joint spaces that are stiff, that are unflexible, that hurt all the time, may not be the joint at all. They may be the nerves that are going to the muscles that control the joints. It also may be what we're talking about right now with the intestinal tract.
Right, intestinal tract things. I think the key thing you're looking for here, Shirley, is also making sure there's balance. And like Tom was saying, you've got to take a really look at how you're handling sugars. And that could also be a stress mechanism, too, that can affect a lot of the insomnia problems that people have with sleeping. So that's one of the things you really want to take a look at with that. But the balance, once you introduce a hormone, make sure that the other hormone bases are not thrown out of balance. Balance is the key here.
And I ask you one other final question. What is a good herb for bags on your eye? Is there anything we can do?
No, there's no herb for bags underneath your eyes. You have to find out what's causing the bags underneath your eyes. That's usually an allergy reaction if you're puffy, or if it's really dark circles underneath your eyes, that's a fight-flight system, that's an adrenal system. So before you go to try to put the symptom out, you have to treat the cause. And my feeling is that the same thing that's not allowing you to sleep is also causing the bags underneath your eyes and the swelling.
Okay. Well, thank you so much.
Shirley, thank you for your call. We appreciate it. 888-630-9625. That's 888-630-WMAL. My guest in studio, Dr. Scott Lamp. Your host this Wednesday evening at the Roselle Center for Healing. Dr. Lamp's going to be talking about irritable bowel problems and all those things that cause you a lot of discomfort. Go ahead. You were about to say something. I stepped on your tail there.
Well, I think one of the things is that also you think about sometimes these things are emergency conditions. The irritable bowel disease can be that badly, and I think also people are put on steroids, immunosuppressives, painkillers, anti-inflammatories, but they also have side effects. And I think what happens is after you've got a major flare-up or you have to have an IV or something like that and you've come back and come home, this is where sometimes the disconnect is. And you got to understand the steroids dampen the system. And there's a lot of things with steroids that create problems to affect the immune system even farther. So you really got to get started on rebuilding the body, build it back up, build up that gut. It's very, very important. Diet plays a part. Lifestyle change plays a part. Like Tom was talking about, there's some acupuncture elements, there's some chiropractic elements too that are very, very important, and it's kind of like a multiple team approach. These things, when they come up, it's not a very easy process. You really have to be a good detective to find out all the problems people have.
You know, we're so hooked on grain products in this culture, and probably because because of pizzas and sandwiches and things, and they put wheat into everything. They coat wheat on everything imaginable.
In your wine.
And yeah, unfortunately, I mean, it's like, give me a break. Quit messing with my glass of wine at nighttime or every other night. But you're right. I mean, look at the processing of things, and suddenly you find out that you're being bombarded, and if you're not at least going to be allergic to something, you're going to end up with a very significant gluten sensitivity that is going to perpetuate itself in all the conditions that we're talking about, particularly something called Crohn's disease. Right. You know, and we do something called an adrenal stress index with people, which measures a lot of things, but one of the things it measures is something called IgA antibody, which is your first line of defense. It's your mucus secretion of any of the nonsense that comes in, bacteria and viruses and allergens and toxins and so forth. And there's a piece of the IgA antibody called gliadin IgA. and that's a measure of your sensitivity to glutens. And so when we get a really suppressed IgA pool, if you will, total amount, and the minimum level should be about 25 units, and we'll get somebody that comes in with 10, and and their gliadin level is borderline, at like 9, and then I tell the patient, listen, even though you're not over the top with your gluten sensitivity based on the score, to really interpret this thing, you have to take the gliadin or the IgA level up to normal, which would be, we have to go 2.5 times, so 2.5 times 10 is 25. Now we've got to take that 9 and go 2.5 times that, and now we're up over the top. We're at a place not only we got slight irritation, but we got a full-blown gluten sensitivity.
I think one of the things is to kind of really take a look at this is this mucus that's in our bowel, and he's talking about the secretory IgA. Think of it like, I think my analogy is bouncers at a swanky hotel. And you don't have a lot of bouncers, you're going to get a lot of riffraff coming in your hotel.
Yeah, pretty much.
And that's pretty much what we're talking about here. So what happens is that those numbers are depressed. Anything can start walking in.
We're talking about people's immune responses when we're talking about anything that goes wrong with the intestinal tract. We're talking about your ability to have flexible joints, your ability to have energy, your ability to feel good, your skin looking clear, your capacity to be able to think coherently and lucidly. If you're having those problems, it could be the gut. And I know this Wednesday evening, Dr. Scott is going to go over this step by step. He's going to show you what can be done. He's going to show you outcomes that are amazingly significant. If you'd like to attend that class, all you have to do is call us 703-698-7117, 703-698-7117. If you'd like to talk to either one of us off the air, you can do that by going to rosellecare.com or go to drtomroselle.com and take a trip through that. We have a lot of interactive videos there for you. You can learn stuff. All of our healthcare classes of time gone by, not the new ones, but the older ones are there. You can look at those. But take a trip and give us a call, 703-698-7117. We'll be right back after this important information.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle Web Store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle Web Store on Amazon.com today. Visit drtomroselle.com and click on Roselle Web Store. That's drtomroselle.com and click on Roselle Web Store.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. Hi, this is Dr. Tom Roselle, host of Dr. Tom Roselle Live, reminding all women to conduct monthly and annual breast exams. Also consider a thermography scan from the thermography centers as an adjunct to your routine breast exams. Thermographic imaging can detect abnormalities years before a mammogram, and it's safe and non-invasive. For more information, call 888-485-7736 or visit thermographycenters.com. Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live. We're here every Sunday at 12 noon, broadcasting to you from 105.9 FM and 630 AM WMAL. Love to talk to you offline, on the air. It doesn't make any difference. We're here for your educational purposes and to help you in any way that we possibly can. My guest in studio today has been Dr. Scott Lamp, who will be your host, your presenter, this Wednesday evening, the 6th of February, and he's going to be talking about the topic we've been talking about today, irritable bowel problems, intestinal tract, immune dysfunction. You know, the thing of it is, if you have weight that you've done everything, I mean, really, honest to God, have done everything, can't get off, you got skin rashes, you don't feel good, you have headaches, your gut's cramping all the time, you have loose stool, or conversely, you have constipation, it starts in the gut. Health starts in the intestinal lining. And if you're messing that up because of all the things that you're putting in there, all the sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives, I say that pretty good now, you know?
Yeah.
I think I've done it probably 10,000 times.
You do it in your sleep, by the way.
I do. But the thing of it is that that's what causes, besides the injuries, besides the emotional stress. Join Dr. Scott this Wednesday evening. I think you're going to find a way out of this mechanism. Let's talk a little bit about what you're going to cover Wednesday night.
Well, I think first thing is we're going to talk about what proper digestion is. I mean, you got to start from a point of a positive element. So we're going to talk about what the positive aspects or proper digestion is, how to support it particularly. And then also the irritating factors. We'll go in a little bit more in depth into some of those things, and the microbes, the allergens, the inflammatory foods, et cetera, we kind of touched on here today. The other thing I like to do is also go through a 5-step program on how we handle things in the office, and how to go after it, and there's ways to show that. Some of the latest specialized diets, there's things like the GAP diets out there. We have our dietitian there currently is certified in GAP and teaching and instructing on it, so that's a good thing to have in the office. And then the self-grading questionnaire for yourselves. Kind of find out where am I versus the world. It's kind of a good way, a workshop, kind of give you a figure on different elements of digestion and where that plays into. And then we'll do a little tease. We'll talk a bit something about whipworm, and I'll let it sit at that.
You're really going to get into it, huh? That is, yes. If you want to see ugly at its worst, attend this lecture. I mean, I'm not even going to tell you about that thing, because that's a topic we could spend the rest of the program on. If you want to touch on that Wednesday night, God bless you, Dr. Lamp. And this is a problem that is significant, and it can cause all kinds of damage to the body, and you won't like what it looks like, and you won't like the effect that it has in your body, and you really had to bring that up, didn't you?
Yeah.
Yeah, well, Wednesday evening, if you'd like to join Dr. Lamp, 703-698-7117, and you're going to learn a lot, probably a whole lot more than you asked for.
What do you talk about ugly?
Yeah, just show up for the class.
Gotcha.
Never mind. We won't go there.
Yep.
So, but people can walk away with really getting a handle on their intestinal tract function problems. They can turn things around. They can make a difference. This is something that you don't have to live with. You can really heal the body up. And it's amazing to me that we neglect, when we talk about disease processes, when we talk about the symptoms that are associated with so many different conditions, the one thing that people, meaning professional people, fail to look at is the gut, is the intestinal system. Mm-hmm. They don't explore that, and that's the most critical piece of our anatomy when it comes to really fixing anything. You have to fix the environment. You have to fix the terrain. It's absolute, otherwise you go nowhere.
One last point. We want to live. We want to have life to be as best we can possibly be. Then why do we eat dead foods? We need to have live foods. Yeah. And we have to understand that. So if you want to live, live foods.
Yeah, people don't eat vegetables. They think that ketchup in a pickle is a vegetable, and it's dead anyway.
Right.
It's amazing to me. I mean, we look at people on a day-to-day basis with all kinds of different conditions, from strict old back pain to allergy reactions to shoulder problems to I can't think, I don't feel good, I haven't been able to focus and I can't remember when. And the one component that we don't look at is all the interplays, all the interreactions of the intestinal system. And I know this Wednesday evening you're going to do that. So join Dr. Scott Wednesday evening, the 6th. I promise you it's going to be a very interesting evening, particularly if you don't know what a whipworm is. 703-698-7117. I'll be here next week with a very special guest, a man who survived lung cancer naturally. You'll be delighted and impressed with the story. This is Dr. Tom Roselle.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.